Hello and welcome to Africa Today. I am Esther Mokwariola. Every 60 minutes in Africa comes with a strong possibility of health concerns, making the next news bulletin featuring disease conditions arising from poor sanitation and inadequate healthcare delivery. From polio to cholera, measles to malaria, the measure of response, management and control rarely match the scale of disease incidents and outbreaks that are largely preventable, with casualties often avoidable. And so we ask, what are your thoughts on healthcare in Africa and repositioning the sector for sustainable development? You can join the conversation and share your thoughts with us on Twitter at TVC News NG. We take a report now, and Africa Today will be right back. Welcome on board.
Rural dwellers trudging through farmlands in search of medical care. They converge on a primary health care facility to get medical attention. The young and old are demanding to be attended to upon hearing news of a free medical outreach to be conducted by medical experts. Bunkure town, where the facility is situated, is bursting at the seams with ailing residents with little or no resources to access medical care in urban areas. Medical experts say thousands of less privileged people and the vulnerable are in jeopardy, as only a few of them enjoy services covered by health insurance firms. Lack of transportation resources and a minimal number of primary care physicians are among some of the barriers to receiving adequate healthcare services.
As you can see, there are a lot of people outside. You'll wonder that these 1,000 people are sick people just from one community in one local government, that these people are sick and majority of them, they are staying at home and they could not access health care. And this is one of the reasons why we come down here to see if we can reach to the less privileged in the society and those that doesn't have the means actually.
The experts believe addressing underinsurance, uninsurance, amongst others, by relevant authorities would positively transform healthcare centers situated in remote areas.
There must be more funding to the health system, not only NHIS and the state contributory health. There must be like zakat to provide some percentages for the health care of the less privileged in the society and the vulnerable, and at the same time to mobilize funds from the KED fund for these people and also provide community NHIS contributory health insurance.
Kano State government recently announced the revamp of numerous primary healthcare centers and the establishment of general hospitals in most rural areas, and the distribution of free drugs to respondents in the state to meet their medical needs. Rural residents, especially those who converge to receive free medical care in Bunkure, believe the government needs to do more if their demand for comprehensive health care is to be met.
Well, before we get into the discussion of the day, let's update you on some of the top news stories around Africa. A Zimbabwean opposition lawmaker has reportedly been arrested after he called President Emmerson Mnangagwa a dog incapable of leading the country. 3 civilians in Mali have been killed and around 30 people wounded in a suicide attack in the country's violence-hit north. Reports say some of the injured were subcontractors for the UN. Ethiopia has detained the former head of a large military-run industrial conglomerate a day after the country's attorney general disclosed that $700 million was embezzled from the firm. Now joining me to look at healthcare in Africa and repositioning the sector for sustainable development is Tofumi Omie, a 6th-year medical student of organizing chairperson in the Federation of African Medical Students Association General Assembly. Good to have you here on the program.
Oh yeah, it's good to be here.
Now, let me begin with you now. It's about only you actually in the show. So let's look at the rate of, because we're talking about the sustainable development goals in Africa. How would you rate the level African countries has gone now to achieving good health and well-being for its citizens?
Okay. Generally, I would say there's been significant progress. I mean, compared to the MDG. So there's progress, but we're still lagging behind significantly, especially in achieving SDG 3, which is healthcare for all, universal health coverage.
Right.
So a typical example is Nigeria. If you look at the NHI, the insurance scheme, just about 1% of Nigerians actually have insurance, but at least it was zero before, but now we see it moving. So there's progress, but Africa generally is still lagging behind in achieving SDG 3.
So in looking at what we're lacking behind, what exactly are those things you notice?
Okay, I think one significant thing I've noticed is the willpower
Right.
of either politicians or citizens in general. So a typical example is Rwanda. So Rwanda has almost 83 or 85%, healthcare coverage. Vaccinations is at all-time high. So they have significant good metrics in the aspect of healthcare. And if you look at the story, you see that there was a willpower among politicians that, okay, we need to fix healthcare in this country.
Right.
And because they say we need to fix healthcare, then they put funding and they put policies in place. So I think that's one key problem. Willpower connects to policy, connects to funding, connects to education. Yeah, so I think that's been the major issue.
And we have this target to achieve by 2030.
Yeah.
That's to ensure that everyone has access to good health by 2030. But some are saying that isn't feasible. Do you think we're towing that line of achieving that?
Okay, generally, Africa is going. I'm an optimistic person.
Right.
So I think we are in the line.
Okay. What
We are
makes you
in the
think
line.
so?
Yeah, because of the progress that's been made. Maternal and child is an all-time high. Poverty is an all-time high. All the metrics are at an all-time high, even though it's still below the metrics. But at least there's progress, and I think that's the most important thing to look at. And I think that's something Bill Gates usually talks about when he talks about investing in Africa, is that we shouldn't look at the bad metrics. Look at the fact that we've moved.
Right.
So if you focus on the positive, okay, we've moved, then you think, okay, we can keep on moving, and then just maybe it might be possible to achieve this goal.
And in achieving this goal, you're talking about willpower, you're talking about, other things on the ground.
Yeah.
You're a medical student and you've been in, you've seen things firsthand. What are those things you see that is putting us behind, even though you are optimistic that we will get there by 2030?
Okay, I think this remains the key general things. One of very important is there are not enough meetings and conferences you get going around talking about, okay, how can we achieve this? As in Nigeria. So that's where a conference I'm organizing by repositioning healthcare in Africa for sustainable development at University of Ibadan comes in place. So it's like a strategic meeting. We bring healthcare experts to bring youths. And bring both of them together. Okay, let's discuss these issues of SDG, of sustainable development. How can we best achieve it? Then resolutions or papers from the conference will be given to the World Health Organization, who's a big sponsor of the program. So that's the major thing. There are no meetings, then even policies. So we're not changing our policies in order to achieve this.
Right.
We're not increasing funding. The typical example is the amount of money that's meant to go into healthcare funding that was signed in ECOWAS. But you see that still every time the budget comes out, it's still significantly lower than what it's meant to be, far lower than the WHO recommendation. So I think those are the major things putting us back. If you try to increase funding, if you change policies, you'll see that things are actually going to get better.
And talking about your organization now, that's the Federal Medical Association, having to hold a meeting, the first of its kind, I assume.
Yeah.
This meeting now, is it all about talk? Because we usually have talks about, yes, Nigerian health sector, Africa's health sector is in a dismal low. We do not know where we are going. What, aside from talk, are you looking at to ensure that, whatever is being taken out in terms of the conference is being implemented for the good of the people? Okay,
so that's an interesting question. When we were thinking about this conference, we thought of it in that line that there are so many talks going around. We wanted action. And then so we decided that, okay, which organization is the top policy organization that we know when they recommend things, governments actually take it. And then that was the World Health Organization. So we have them as a sponsor. Then we thought, which organization can actually fund projects? Fund random healthcare projects across Africa. Then we look for the largest healthcare company in the world, which is Johnson & Johnson, as a big platinum sponsor of the program. So looking at those two big bodies that we know can significantly change things, then we decided to have something we call a rescue hackathon. So a rescue hackathon is that will bring people together through all these problems that we'll talk about and get them to hack away solutions, sustainable solutions towards fixing the problem. Solutions from this problem were actually going to be recommended to the World Health Organization, and they're going to take it up because they're already funding this project. So when they take it up, we know that it's going to transform into significant solutions, certain solutions directly for people, something that maybe next 1 year or in the next few months, you see them already being reflected in the policy papers and putting as recommendations to healthcare institutions all across Africa.
No, I like your dream. I love your enthusiasm in ensuring that Africa has a good healthcare. But one is also asking this question: how are we sure that we don't have persons like yourself, leaving these shores and perhaps giving out your best for another continent, perhaps Europe or America?
Yeah, so that's a big problem. And the truth is, if you look at it, if you compare statistics or any metrics you want to use to compare one enjoying work, outside it's much better.
Right.
But also, I mean, one of the reasons why it's also worse here is because people aren't caring about it. That's the people either in powers or different people in different
talking about welfare.
Yeah, welfare positions and those kind of things. But also another important thing, I mean, one of the themes we also have in the conference is like medical education and things like that, which we think that, okay, if you tell people to start to actually think about these issues, if you tell people that, okay, this is a serious problem, many Nigerian doctors are leaving, many people are leaving the shores of this country, and we think maybe they can start to change welfare of doctors and start to change how things actually appear, or even increasing payment for doctors, not strikes and all those interprofessional rivalry.
Well, let's quickly go on a very quick break. Now you're watching Africa Today, and we've been looking at issues concerning developments of the health sector. When we come back, we'll discuss the way forward on this show. Stay with us.
Nurses are the foremost people patients meet at the hospital. Here in Nigeria, many patients are known to have complained about their attitude, claiming they are sometimes too far from the reality of the pains of their patients. In this conference, these nurses weren't in their uniforms, but professional development was on their minds. They found it a good opportunity to explain their conduct, which many pick holes about.
If you employ enough nurses, then we'll have them working for fewer hours, because these nurses have to rush, especially in Lagos State, considering the traffic and all that. The nurses have to leave their homes, they have to rush to their places of work. Some of them have not eaten, and they're on their feet from morning till they close their shifts. How much are they being paid? How many of them can confidently take out like 100,000 or 50,000 to pay for a training?
The UN recommends one nurse to 4 patients, but here in Nigeria, that's very far from the picture. The nurses say sometimes they have too much to handle. Esther Oshunluyi is a Nigerian nurse working in the United States of America. Listening to her clearly explains why Nigerian nurses want to leave the shores of the country for greener pastures.
I've been coming to Nigeria in the last 3 years, and I've been visiting a lot of government and private hospitals. A lot of the infrastructure, they are really run down. We don't have enough nurses to even take care of patients. Sometimes you go to the health centers, you find only one registered nurse in a health center working there. No relief, nothing.
The Lagos State Commissioner for Health says the Global Sustainable Development Goal for healthcare delivery can only be realistic through impactful funding of the healthcare sector.
We need to address poverty, we need to address our economy, we need to address our environment, we need to address health, sanitation, etc. So that's a huge task. And so everybody must work in unison with passion and dedication.
The federal government is happy that within 2 years of the existence of the SDGs, Nigeria has scored 48% in the 17-point goals. It believes with more round pegs and round holes, more progress will be made even in the health sector.
Welcome back. Now, out of the 17 interwoven Global Sustainable Development Goals, SDG number 3 is specific on better healthcare and improved well-being. Now, in the coming days, professionals under the Federation of African Medical Students Association will be meeting in Nigeria to reposition Africa's healthcare for sustainable development. Well, I still have Tofumi Omiye with me, 6th-year medical student and organizing chairperson, Federation of African Medical Students Association General Assembly. Now let's look at, the reports that played back, talking about, improving our health sector, and that can only come when we have an impactful funding, according to the Commissioner for Health of Lagos State. Now, that still brings to mind the will you mentioned earlier on while we're discussing that. If we have a government that has a will, to ensure that our health system moves from where it is to where it is hoping to get to by 2030, wouldn't be where it is today. But how much readiness or how much funding do you think the government has put in the health sector that we can say, yes, we have something to work on?
Yeah, that's an interesting question. Recently, there was this 1% of consolidated revenue fund that was going to the primary healthcare. So primary healthcare is the most important aspect of healthcare generally. So if you have malaria, and most of diarrhea and all those diseases, you should come to a primary healthcare center. But the problem is they are not enough. So that's why you see people travel miles just to get to maybe Lutz or UCH. So that's one aspect of funding that has been put in that I think, it was significant progress, it was laudable, but we need more. And we need everyone to understand that we need more. Even private individuals should actually start thinking of investing in healthcare. It's not only the government. And that's one thing you see in some other countries have significantly better healthcare system. You see private individuals donate millions of US dollars in building healthcare institutions or just donating into specific diseases. If we actually adopt that, that would also significantly help the government in the aspects of funding.
And talking about, helping the government through the private sector, do you think the private sector has the support it needs now to partner with the government? Because even in Nigeria, for instance, we understand we have only 2 teaching hospitals that serves about 20 million residents, and we haven't talked about other states that have maybe little or no teaching hospitals now. So the private sector definitely have been overburdened, more or less, providing the necessities for the citizens of a particular state. So how much of support do you think they are getting to help the government, in pursuing its agenda of improving healthcare for the generality of everyone? Okay,
so that's interesting. There was a new coalition that was formed about maybe 4 or 5 years ago, Private Healthcare Network Alliance. So it's a public-private partnership between the government and some private institutions and even banks and other financial institutions. So the government, everyone is talking about these things now. That's the beautiful thing. So when everyone is talking about it, the government is starting to look, okay, it seems like we're not doing so well in this aspect. Let's change policy, let's shift policy. So there's progress. They're starting to look at private institutions as being significant partners in helping to make our healthcare dream a reality.
Okay, let's still look at your medical association's plan now. You intend to change the narrative and ensure that perhaps you get, good healthcare for all. Now, let's be more specific. How do you intend to achieve this?
Okay. So the truth is, in achieving good healthcare for all, there are different levels.
That's your medical association.
Yeah, the medical association. So there are different levels. So the first level is advocacy and awareness. If many people don't know about it, no one's going to do anything about it. If the people to do something about it, they don't even know something like that exists. And so that's where our association comes in. So we do a lot of advocacy projects. For example, this kind of conference is also a significant advocacy project. Eventually, we'll be able to do outreaches to multiple places and get people to understand, oh, there's something like universal health coverage. When you give power to the people, that kind of knowledge, and make people understand, okay, there's something like this. You can go to the hospital and be able to get treated without being asked for money. Then you see that they will start to demand from the government something different.
Right.
Yeah, so that's that basic level that we stand, which I think is extremely important in achieving our healthcare goal.
And for the modalities involved, how do you intend to pursue this?
Okay, so like I mentioned about the policies and changing policies, I also mentioned another key thing is outreaches. So we go to, for example, different local governments, talk to the heads of the local governments about this kind of issues, and then also do a lot of outreaches for them. So those things are significant ways. And that thing also is medical research. So that's one of the key sub-themes in our conference.
Right.
And we have like big sponsors that are thinking of announcing innovation programs, you understand, in order to fund medical research in Nigeria. Medical research,
that's also something that we should be looking into. But what are the challenges ahead, and how do you intend to surmount them, as an association that hopes to achieve, will I say, a positive for the whole people?
Okay, I think one of the key challenges still is funding, because if we talk about doing outreach programs and trying to talk to heads of local governments or heads of states, you start to look at who's going to fund that.
Right.
But yeah, so I mean, that's what we're trying to work with key partners also in order to be able to achieve that. Also, in the aspect of medical education, medical research, we're trying to talk to deans and provosts, you understand, heads of medical institutions all over the country and even the continent. And I mean, those are challenges. We understand there are significant challenges in order to achieve this thing. But we are grateful and we're happy that we're making progress, and we think we can actually, with the right partnerships, with the right aspects of funding, we can actually be able to overcome these challenges.
Okay, now let's still look at the issue of brain drain, even
Okay.
though, you know, it's part of what we get to see almost on a daily basis in
Yeah.
our country, where professionals who are skilled at in their jobs are taken out, or they, you know, look for better jobs outside. Are you also looking into that line, and how do you intend to involve the government in this, you know, area now?
Okay, so we're thinking of that line. It's not part of our core project yet, but it's something we're starting to look at. And I think the first way we want to, or we plan on involving the government, is making them understand the statistics. That every week, I don't know how the number is, but every week many Nigerian doctors are leaving. So if you make them understand the statistics, then the next is how can we solve this problem? And one of the key things is infrastructure. Are there enough hospitals? And the hospitals that are available, how do they treat the doctors? So do they pay the doctors well? Is the working environment nice? So when you lay down these problems, because many times we just talk, the government isn't actually listening or hearing these things, but you have these key problems and you engage the government directly on a one-on-one basis. We think that's one key way we can actually fix the brain drain. And it's going to take a while, but at least we're going to make significant progress over time, and we think we can be able to, make significant changes in
So
that.
in a nutshell, to achieve progress, to sustainable development goals 3, and of course for the whole continent, what should be a way of handling this and ensuring that we have good health system for all?
Yeah, one way of achieving this is engaging all stakeholders. Everyone is important, the government, the private healthcare institutions, the funders, even citizens. So engaging everyone at once at different levels is actually the best and only way to actually get to achieve this.
All right, let's leave it at that, and I hope the relevant authorities get to listen and, of course, implement the needful for everyone to enjoy the benefits of quality healthcare. Tofumi Omie, a 6th-year medical student and organizing chairperson, Federation of African Medical Students, it's a pleasure to have your thoughts analyzed on Africa Today. And as the world pushes towards a healthier planet for all, Africa continues to play catch-up where institutions are struggling, infrastructure is degrading, and intervention remains poor with respect to disease outbreak and control. Home to some of the fastest growing economies in the world, poor healthcare systems in Africa remains a potential setback, requiring the political will to commit more resources in meeting the demands to ensure sustainable development. And that is our package for tonight. But don't forget to join the conversation as usual on Twitter at TVC News NG, and also follow me for updates around Africa at Esther TVC News. Until the next one again, I am Esther Mokwariola, and always remember, Africa can only get better.